examination demonstration session. Patients are examined on the right hand side of the patient. We start with general examination. Before you examine a patient, you greet the patient and introduce yourself and obtain permission. Good day, I'm Dr. Alex. How are you? Please, can I examine you? Thank you. Then after that, you position the patient and ensure the patient is well exposed. For general examination, you need the patient to be exposed. And the position is the anatomic position, which is supine position in bed, with the patient supine, the palms facing upward. General examination starts with inspection. Are you with me?
Yes, sir.
Inspection, you look at the patient from the head to the toe. You note whatever you can see on the patient. You look at the patient's general outlook, the estimated age range, whether the patient is a young man, when you think the age is below 40, is middle age, between 40 to 60, is elderly, from 60 and above. And then you look at the general health status, whether the patient is acutely ill, critically ill, chronically ill, or is not ill looking. And then you also note like an infusion that is in situ. You note the type of cannula and what type of infusion is running. If a patient has a catheter, you also note it. So after the general inspection, you now start the specific examinations for general examination. It's good to walk from the head down to the toes. So we start by checking the hair texture, whether there is fluffiness. Is that clear? Then after that, with the dorsum of your fingers, you check for warmth. And then use the tongue to lower the lower eyelid and look for conjunctival pallor. Then after that, with your left hand, the thumb and the index finger on the upper eyelid, you raise up the upper eyelid. Bring your right finger, ask the patient to focus on your right finger. Look at my finger. Look at it, follow it. Then you look at the sclera for jaundice. After that, you come toward the mouth, you look at the nose and see whether there is flaring. Then in the mouth, you ask the patient to open the mouth. Bring out your tongue. Raise up your tongue. Raise it up. Okay? 3 things you look out for in the mouth. You look out for cyanosis, you look out for pallor, and you look out for dehydration. You look at the tongue, you look at the buccal mucosa for pallor. You look at the tip of the tongue for central cyanosis. And you look at the surface of the tongue for wetness to determine whether there is dehydration. After that, remember we are working from the head downwards. After that, we now check the lymph nodes in the neck, whether they are palpable. You can do that by asking the patient to sit up, or you can also do it with the patient in the lying position. If we were to do it in the lying position, you go systematically. Start with submental, submandibular, pre-auricular, post-auricular, raise your head, occipital, and then cervical upper group, cervical middle group, cervical lower group. Shrug your shoulders, and then you check supraclavicular. Another way to do that is to ask the patient first, sit up, and then you come behind the patient and check submandibular, preauricular, upper cervical, middle cervical, lower cervical. Raise your shoulders. Supraclavicular, then post-auricular and occipital. Some people, when they want to do post-auricular, come in front of the patient and do post-auricular like this and occipital like this. It's all accepted in such all the demonstrations we have shown. Is it clear?
Yes, sir.
Then after that, in general examination, we come to the axilla. To check the right axilla, you shake the patient with your right hand, abduct the axilla, and place the forearm over yours to relax the muscles. Then systematically you palpate the 6 groups of axillary lymph node: the medial group, the anterior group, the posterior group, the lateral group, the central group, and you dig in for the apical group. After that, for the left, you shake the patient with your left hand, abduct to expose the axilla, rest the patient's forearm on yours, check the medial group, the anterior group, the lateral group, the posterior group, the central group, and the apical group. Some people, when they want to check the lateral group, they change hands and use the other hand to check the lateral group. Whichever method you do, they are accepted. After that, you check the epitrochlear group. You feel for the olecranon and dig your fingers into the epitrochlear regions and feel for lymph nodes. You also check on the other side. Then now we are in the palm. You pick the hands up and first of all look. In the hands, you first of all check for palmar pallor. Assuming you are not anemic, you compare the patient both palms with yours. Then after that, you turn the dorsum of the hand and you look at the fingers at the nail bed for peripheral cyanosis. Then you check capillary refill by pressing on the nail and looking. Once you press on the nail, there'll be blanching. Then you see how long it takes for it to become red again. It should be a matter of a second or two for normal capillary refill. Then after that, you squat by the patient bedside and look out for finger clubbing. You look at eye level for finger clubbing. If you do find, you characterize it and stage it. Then after that, we are done with the hand. We are now at the groin. We are working general examination from the head. So just you expose the groin and you palpate the inguinal group of lymph nodes. After that, we come to the popliteal. You flex the knee, dig your your fingers into the popliteal space and palpate for popliteal lymph nodes. Then finally, not finally though, we are now at the feet. Here you check for pedal edema. First of all, apply pressure on the dorsum and see whether there is edema. If not, you go to the malleoli, apply pressure and rub and see whether there is edema. Once there is no edema at the level of the malleoli, there is no reason to continue. But if there is edema, you continue along the pretibial region where the tibial bone is prominent and continue to check up to the knee and sometimes even beyond to the level of the edema. The last thing on general examination, especially for a patient who has been in bed for some time, is to check for the pre-sacral edema. That's the end of general examination. Thank you.